Hey everybody, Healthy Prepper here. Today's topic is diarrhea. Hey, let's talk about nausea, vomiting, and diarrhea after an SHT event and you're a prepper and you're out there and there's no help around. You've just got your basic set of supplies and you're trying to make it through. And lo and behold, either you or one of your close cohorts comes down with nausea, vomiting, and diarrhea, basically known as gastroenteritis, inflammation of the stomach and the intestines. Okay, so this is not a pleasant situation, and yes, it can be dangerous. The reason, number one reason, is dehydration. Fluid is coming out of the bottom and the top at a rapid rate, and we need to stop this because this causes more deaths in disaster situations, almost more than anything else combined. In 1998, the severity of the earthquakes, the issue in Haiti a few years ago, Katrina, diarrhea was one of the leading causes of death. So let's nip this little sucker in the bud as we can, quick as we can. Okay, now, it's also known by the name of stomach flu or food poisoning, and as you can see, these may be things we may face if there's no electricity or our fuel sources are low, or possibly we're not cooking our food correctly to the correct temperatures, or, you know, let's say mama was out there and caught herself a squirrel and tossed it in the old solar oven, but the old solar oven didn't get to a high enough temperature and didn't kill all the bacteria in it, so there you go, everybody's got the squirts. All right, so what do you do? Well, the good news is most gastroenteritis or stomach flu or food poisoning is self-limiting. Most of it will resolve itself within 2 to 3 days. Okay, that's the good news. Now, if you've got a mild case of this, you might have a low fever of around 100 degrees or less. You might have some nausea and vomiting, some diarrhea, abdominal cramps, and bloating. Hey, that's a fun day. But if things get worse, no pun intended there. But if things get worse, your fever goes above 101, you could have blood in your stool or your vomit, you could have a severely swollen abdomen, and you could have some significant pain in the belly, and you could be experiencing severe dehydration, which may look like this. You may be weak, light-headed, you may feel woozy, you will have decreased urine output, you will have dry skin, dry mouth, dry eyes, lack of sweat, or tears. And one way you can quickly check to see if somebody's dehydrated, you know, obviously you look at their eyes, if their eyes are sunken in, if their mouth is pasty, if their skin doesn't have much turgor in it, you can do the pinch test, and you pinch the skin, and if it stays up in a little tent-like mark, then that means that the more it stays up in the tent, the more dehydrated they are. See, I'm a little dehydrated, but not super dehydrated. So you kind of test yourself with that. But you definitely need to jump on that. You need to do something. Okay, so when the symptoms first start, right from the get-go, it is important to hydrate the person. And this will be difficult because they have nausea, they are vomiting, and they do have diarrhea. So you're basically trying to get it in one end or the other. So the normal thing is after about 2 days you're not getting any better, you would seek treatment in our regular lifestyle. But since this is a post-SHTF situation, we need to figure out what we can do on our own. First of all, a great question to ask yourself is, can any fluids at all be tolerated by mouth? Can this person take little sips of water, just slowly, even if the vomiting continues, but a little sip or two every now and then, if they can keep that down, that is a plus. That is a big plus, and that is to the good. So continue on that path. Allowing a few more hours to pass, check to see if the nausea and vomiting is resolving. If it's not, you may have to do other things, but let's say that's a good thing. All right. Also, you want to kind of start doing a little survey around your camp. Anybody else in the family, are they experiencing symptoms? Anybody in your community? Did a traveler come in from far away? Maybe they brought in E. coli or Shigella or some other bizarre bacteria that's causing the problem. Be very suspicious of fresh water sources such as streams and rivers, ponds, wells. These often contain Giardia and other protozoans and other bacteria that can cause severe diarrhea, nausea, and vomiting. And It's not pleasant, and just be sure that whoever is in charge of treating the water, filtering and treating and purification, everything is up to snuff and no things are being dropped. You might want to recheck all your equipment and sterilize it again. Make sure that it's not infected and dirty, and you're just re-incubating your water with the same bacteria because it's built into the filter system or something. Maybe it needs to be changed. Definitely check that. Go see who's making the food for your community or in your family. Is the food undercooked, or are they leaving the mayo outside at the picnic where it heats up and blooms all sorts of lovely bacteria? You definitely want to handle any of those issues. And then you need to jump on top of wherever the ill person is toileting, because this is a factory for transmission. Everything that person touches after they wipe their little bum is a potential fomite or something that can transmit a pathogen or a bad bacteria to somebody else. So you want to make sure that where this person toilets is very clean, and they also clean up after themselves. There's a lot of hand washing. People need to be trained not to put their mouth from their butt to not to put their hand from their butt to their mouth. The fecal oral route is the #1 cause of transmission for a lot of these different bugs that give us nausea, vomiting, and diarrhea. So make sure that's all clean as a whistle. And then we need to move on to, let's get this person rehydrated. All right, let's say they're taking small sips. That's good. All right, we're making progress. Now you can advance them. It's in time to add some electrolytes to that fluid that they're getting. If they're able to tolerate plain water, maybe if you're a prepper and you're working with what you have at home, you don't have IV hydration, and even if you did, you may not know how to work it, administer it correctly. You might end up giving the person sepsis or a blood infection, and that could be worse than you just trying to treat them gingerly from the beginning. So let's try the easy things, okay, first. Definitely give them something with a little bit of electrolyte in it. You can do Gatorade. I recommend dry Gatorade if you're a prepper. It's easier to store. I'd probably put it in Mylar bags or vacuum seal it, toss in some oxygen absorbers. And because the cans that it comes in, the powdered stuff, will seep moisture over time. You'll end up with a brick of Gatorade. Okay, so if you don't have Gatorade, what to do? If you can pull together half a teaspoon of salt, half a teaspoon of sugar in about 8 ounces of water, if you have nothing else, this is a good option. It will give some electrolyte, a little bit of energy from the sugar, and at least it will start to replace some of the things this person is so desperately in need of. Okay, now you can also do flat ginger ale. Remember Mom giving you flat ginger ale when you had an upset tummy? She knew what she was doing. Or ginger, if you actually have ginger, that's good. If you dehydrated some ginger. Ginger is really easy to dehydrate, by the way, and it'll last forever, and it works wonderful in the dehydrators. So always have some dehydrated ginger on hand, or fresh ginger if you have that. Also chicken broth as tolerated. The little chicken bouillon cubes, basically salt and a little bit of chicken fat together. But those are a good thing to advance the person to slowly. And then you will advance their diet as tolerated. A great diet to try them on first if you're not sure what will stay down the pike. These foods are well tolerated on sensitive tummies. Bananas, rice, applesauce, and toast, known as the BRAT diet. Yes, we're talking the little ornery child that causes problems, that kind of brat, but it can be given to adults too. And basically in a prepper world, if you don't have bananas, because you might not, maybe you've got some dehydrated bananas in the pantry, and you can put these in some warm water, soften them up, basically make a mush type scenario with that. Maybe you don't have apples. Okay, birdies. Maybe you don't have apples, but you have, hang on. Okay, maybe you don't have applesauce, but maybe you happen to pick up on your couponing prep adventures some of these little Mylar applesauce packets that can be stored for a little longer than regular applesauce. Although I've noticed the regular applesauce is lasting for a really long time. Isn't that weird? Must be the preservatives these days. But anyway, you can use these, squirt them into the banana mixture, or serve them separately. Then you can also, if you have dehydrated apples, you can do the same thing as the dehydrated bananas. Just put them in some hot water, let them soak up a bit, make some mush or some very thin liquid, depending on how much the person can tolerate. And you are good to go. You should have your rice as a prepper, right? And toast. Well, you know, if you've got your wheat berries, it may be a little while before you can actually bake a loaf of bread, but hopefully you've got a little bit ground up on hand already as a flour, and maybe you could make this person some bread. Crackers are another good thing that are generally easily tolerated. Nothing with too many flavors in it. Some very bland, very, you know, low-fat, dry cracker, not too much salt. A little bit of salt is okay, though, because you do want some electrolyte replacement. Okay, so rehydration is very important. You know, you can use anti-nausea medications if, let's say, this is going on day 2 already and this person's just not holding even small sips down. It's probably time to start some type of anti-nausea medicine if you have it. Dramamine is one type of medicine that you can buy over the counter. There are a lot of different anti-nausea medicines that you can buy over the counter. If you can get a hold of some prescription medication like Phenergan, it comes in a rectal suppository. Also, this is sometimes a problem when the person has diarrhea, but it's if they're vomiting and they just can't even hold down a Phenergan pill, then Phenergan rectal suppository will work. And also, if you've ever been on a cruise and you've been given the seasickness patch, that will, scopolamine patches, they're called transderms, things like that. You can put one of these on the back of the ear to help with nausea and vomiting, at least so the person can get in more fluids. Although after about a day, you want to remember to take the patch off, or this person might experience hallucinations and walk around, yes, like a zombie. So we don't want that. We want them feeling better. So there you go. Those are the ways to get some fluids back into the person and increase and advance their diet as tolerated. We've talked about rehydration, treating the symptoms. If the person does have fever, and if you are going to be using other measures such as antibiotics and that, you may want to go ahead and treat the fever so the person isn't suffering completely. There is another school of thought that you just want the fever to let it run its course and burn out the bacteria or the offending organism by increasing the temperature inside the body. You can do that as well. Depends on your philosophy. But remember to prevent the spread of infection, as we spoke about before. And oral rehydration is your best bet. Small sips as tolerated. Increase amount and frequency as tolerated. Remember, this is the #1 cause of death in underdeveloped countries from infectious diarrhea, including cholera. So we definitely don't want to be dealing with things like that. And they will be rampant after an SHTF, serious SHTF event. So advance the diet. After you get off the BRAT diet, you know, you can increase to you know, more substantial foods. You can go up a scale of rice, wheat, bread, potatoes, lean meats, chicken. Stay away too much from fatty food, as that tends to trigger nausea. There are a lot of antibiotics that treat gastroenteritis. Sometimes it's recommended not to use any because some antibiotics will actually make the diarrhea worse and allow other bacteria to overgrow in the intestine and make things much worse. So you don't want to end up with a case of salmonella or C. difficile making things worse by adding antibiotics. So Bactrim, Cipro are good gastrointestinal antibiotics. There are certainly a lot more out there, and make sure you school yourself on how to use them and realize it will be pot shotting. We don't know what we're treating here. So if the person has, you know, nausea, vomiting, and diarrhea, and you're not able to stop it, it's not slowing down on its own, but you know, so then you're thinking by day 2, I need to start, you know, anti-nausea medicine and maybe some antibiotics. And let's say you're doing everything and it's becoming dangerous. The person is losing so much fluid. You're getting very concerned and you got them on the other stuff. It may be time to add an antidiarrheal. Generally, these are not recommended because sometimes if you slow down the expulsion of the stool, which is the body's natural way of flushing the gastrointestinal tract, if you slow it down, you'll actually end up retaining the bacteria inside the person longer, making the illness longer. So it's kind of a mixed bag. You just have to get a sensation of when it's time. But you're thinking around the 2 or 3 day mark. If things aren't really perking up by then you need to start thinking about these other alternatives. They all come with risks and they all come with potential benefits. You know, Pepto-Bismol is a great medication to help reduce diarrhea. So things like that you can easily get at the store and have some of those on hand in case of the SHTF situation. Make sure that, you know, wherever this person, again, I said, is toileting, that they're disposing of the paper and the waste safely, or you are, or whoever is helping them if they're incapacitated to do so. So stay safe, stay well, cook your food well, and make sure your water supplies are well treated, and stay healthy, everybody. And please feel free to add any ideas, thoughts, and comments here, because gastroenteritis is a huge, huge topic. The problem in the prepper world is we'll often not know what we're dealing with, and we won't know the best approach to take. So we may be trying different things. You want to think about timing. You want to think about water loss. How much danger is this person in right now? Are they completely dehydrated? So keep an eye on their water consumption and measure it. Make sure they're getting in, several liters a day to replace the water loss. Look to see how much is going out versus how much is going in. It's not a pretty job, but somebody eyeball it and kind of get an idea. Somebody needs to step up and, take care of that part of the process. But I wish you all the best, happy and healthy prepping, and I look forward to hearing your comments. Take care, everyone.